Hello, this is Chris from the Obstacle Doc, and today we're going to talk about mobility or length of the anterior chain of the lower body, specifically the hip flexors, quadriceps, the TFL, IT band. A lot of individuals can develop tone or tightness in these areas, and so we're going to kind of understand the potential of the Y anatomically, and then an algorithm that we can take you through to help to open up this area. Now, before we get started, though, we do want to preference that tightness doesn't just happen. For lots of reasons, tightness is adaptive. So we can develop tone and tightness in muscles due to the way we posture, our lifestyle factors, the way we move. And because of that, that can tend to create postures and habits and adaptations of tightness. So we don't typically give out stretches by themselves. Because oftentimes we need to peel back one more layer and go underneath that, like why are we actually tight? So take this for a grain of salt. This will usually be done with something else, but when you combine mobility with either some type of re-education, motor learning, strengthening, you get a bigger bang for your buck. So with that being said, when we look at the basic anatomy of the body in the middle here, what I want to key in on is our line of our body, our spine, and our pelvic orientation. So if we take two sticks, we should be able to line up our spine so that our head, middle back, shoulder blade area, and our tailbone line up on the stick with our basic curves at our neck and at our lower back. Second part is looking at the pelvis. If we think of the pelvis like a bowl resting on a table, we want that bowl to be level so that if I take a second stick, we can create a nice right angle here. What happens with a lot of us is that, unfortunately, our bowl tends to rest in a spilt position downward. And the spine can sometimes come with it, or sometimes it actually doesn't come with it. If the spine still stays upright, a lot of times as the spine stays upright, and if the pelvis tips down, a lot of times that creates more of an arch in our lower back. So what we want to think about is understanding this. When we go into our stretches, we really want to make sure we lock down our neutral pelvis and our spine so that we can optimize the length tension throughout the front of the chain into those muscles that we're targeting. All right, so as we are looking at starting the process of understanding how to line the system up, Daniela is going to start in a full kneel position. And now from here, if she's at rest, one of the things that we can kind of look at is we're trying to identify that straight line and that neutral bowl. But before she moves, you can kind of get an idea that the pelvis looks a little slanted, right? So she got a little bit more of a bend here. She has a little bit more of an arch here. So we want to establish that neutral bowl position. So as Daniela starts to engage her glutes, so she's squeezing her cheeks, that pelvis will rotate underneath to create our level bowl. That's the critical piece of this. So the objective of this is to create our straight line, find our neutral pelvis, so that basically we have a nice right angle, and we're going to stay here. For a lot of individuals, you will start to feel stretching throughout the front chain on, again, all those myriads of muscles that we talked about, hip flexors, quadriceps, TFL or IT band, even some of your adductors as well. I usually like to have clients try to hold this almost like a plank, so for at least 45 to 60 seconds to get a really nice appreciation for that. And as you're holding for that amount of time, you might actually feel yourself able to rotate even just a little bit more, get a little bit more glute squeeze. You will also feel some reactive abdominal tension develop too, because these two muscle groups in opposition help to hold that neutral pelvis. That's critical. So when we're teaching core stabilization as to a why these guys might be a little bit tight, if we're lacking control here and here, and the pelvis wants to do that, that might be one of our deeper answers that we're looking for, is actually we have to establish more stability so that these don't rest in that tight position habitually. As a progression from the full kneel, this is a traditional half kneel. You will sometimes hear this as a true hip flexor stretch. And again, we're really driving home the point of the neutral pelvis. So all we did is we went into a half kneel split. We're targeting the down leg here. And again, Daniela is still looking for that same line on the spine. And then she's going to use her glutes to squeeze, tuck, rotate that pelvis to a neutral hip position, neutral pelvis position, abs reactively engage. That's going to really tease out individual length tension on her right hip flexor quadricep, TFL, IT band complex. You do not need to lean. Sometimes that's a misperception with this stretch, is to lunge, lean into it. But a lot of times when you lunge, lean, you lose the pelvic position. And that's the most critical part of it. So for a lot of us, all we have to really do is establish that nice upright angle, get that active stabilization to tilt the pelvis properly, keep our spinal line. That is going to give us our stretch that we're looking for. Similar parameters, we might want to hold this for about 45 to 60 seconds and then switch sides. I am a fan of holding on to things. Don't worry about trying to balance. So do this next to your kitchen counter or your couch. But if you're trying to fight for your balance, it's going to make it a lot harder to really kind of hold for that amount of time. Lastly, with this position, again, to help with balance, think of your feet and your knee kind of more on a railroad track, not on a tightrope. So if your left or your lead foot is right in front of this, it's going to make you a little bit more wobbly. So have a little bit of space between your legs to help with stability. As a final variation to our full to half kneel mobility progression, we are going to use a back prop. This can be a variety of different heights. What I will say as a disclaimer, the higher this is, the more aggressive this stretch is, as well as the increase in challenge to find the optimal position that we're looking for. So you don't need to be greedy with this to get what you want out of this. It also does target some specific muscles of the anterior chain that cross both the hip and the knee at the same time. We're kind of targeting specifically the rectus femoris muscle, which is a two-joint hip flexor kind of quadricep muscle. That one can tend to get really tight on individuals, again, for other reasons, but we can just kind of parse that out as compared to when the back leg is flat. It targets other muscles. So to get into this, Daniela's going to prop up the back foot. She's going to drop her knee down to her pad. And then we're holding for balance. Now, as you can see, we have a lot more angle here on the knee. And we're still going to achieve as best as we can that nice straight spine and that really, really good tucked pelvis activated from the glute and the abdominal wall to keep that bull level. Having a little bit more knee bend here is going to increase that line of pull coming all the way through on that rectus femoris muscle. This can be referred to as the couch stretch in different environments. So think about a couch, propping your foot. Again, all I will say as a disclaimer, the higher this is, the harder it is to maintain that position. I would rather sacrifice height to get more technique. And then as you gain mobility, you can add more height as you need to. Comparing both sides, again, if we're looking at single-sided differentials, you can compare to kind of get an appreciation for the intensity of the stretch, the ability to make the anatomical lines correct. Some people might find it's harder to make the pelvic rotation or to stay in the position if that one side is harder. You might have a harder time finding your glute or your abdominal wall as you're trying to find that position because that tension is really pulling you out of position. Stretch parameters can be the same, again, 45 to 60 seconds, a couple times each way. For those of you that find the couch stretch a little aggressive in terms of its intensity, but we still want to target the kind of knee extensor component of that anterior chain, again, we're thinking of our rectus femoris muscle, we can soften the hip flexor component by basically getting rid of it. But at the same time, we can also still think about that neutral pelvis position to really lock in the appropriate muscle length that we're looking for. So on your stomach with a strap, this can be pretty creative. There are obviously on the market stretching straps that you can use, yoga straps, but clients can use belts, they can use long blanket sheets, anything to get around the foot and ankle to get above. As Daniela starts to wind up, she's bringing her heel towards her hip, just like that couch position would be eliciting. But super important, you want to watch for the pelvis. If the pelvis is arching as she winds up, what you'll see is a gap created here, and you'll see an increase in lumbar hyperextension at the expense of getting her heel to her backside. More technically, if she neutralizes the pelvis by squeezing her glutes, drawing her abs in, you can clearly see that the heel dropped back. We don't get quite as far. Spine is less hyperextended. That is a more accurate representation of the muscle length on the rectus femoris or knee extensor component of the anterior chain that we're targeting here. So this can be an alternative to the couch stretch, again, if that's a hard position to get into, but we want to target that specific muscle. You can compare and contrast both sides, holding for at least 45 to 60 seconds. Again, really, really key in here. A lot of people just try to get their heel to their butt. That's their objective. But again, the reality is what are we doing in the middle? That's the more important argument and element of this stretch.